Hey everyone, and welcome back for another deep dive.
Hmm.
Today, we're going to be diving into the world of VR therapy.
Oh, absolutely.
We wanted to get a little bit more into this because it's such a cutting-edge technology, and honestly, I think most people are very intrigued at the idea of being able to, you know, tackle things like phobias or manage pain, all within a virtual world.
Yeah, it's definitely captivating, I think, taking this futuristic concept and applying it to very real human struggles
Yeah.
is something that's very appealing to people. And yeah, we're talking about potentially revolutionizing how we approach things, like you said, like phobias and chronic pain.
Yeah, absolutely. And so let's just dive right into this. So first up, I want to talk about phobias.
Okay.
I was reading that VR is now being used to enhance the traditional exposure therapy that's been, used for years and years
Hmm.
by creating essentially a safe space for people to face their fears.
Right. So imagine if you have someone who is afraid of spiders, like really afraid of spiders. So in a traditional setting, you might have them do exposure therapy where they gradually get introduced to a real spider.
Right.
But with VR, they can put on a headset and be in a control environment.
Right.
And so they encounter spiders in a virtual space.
So rather than freaking out at the sight of a real spider,
Hmm.
they can be in this virtual space and kind of get acclimated to the idea of spiders at their own pace.
Yeah,
But does this actually translate to real-world benefits?
it does. And the results are actually pretty remarkable.
Oh, wow.
So one study found that 83% of participants who went through VR therapy for phobias showed a significant reduction in their symptoms.
Wow, that's a lot.
Yeah, and that's not just a one-off finding. They did a meta-analysis back in 2019 that looked at 23 different studies and concluded that VR therapy is just as effective as traditional exposure therapy. In some cases, it's even better
Mm.
because patients are more willing to participate and they're more engaged.
Yeah, that makes sense because it feels less intimidating than having to face a real spider, so people are more willing to give it a try.
Yeah.
Why is it so effective?
Okay.
Is it just because it's new and people are kind of intrigued by it, or is there something a little deeper going on?
It's definitely more than just novelty. It really taps into how adaptable the brain is and how well it can learn,
Mm.
what we call neuroplasticity.
Okay.
By repeatedly confronting their fear in this safe virtual environment, the brain starts to kind of rewire itself, and those fear responses weaken over time.
Wow.
So you're essentially training the brain to react differently.
So it's like almost a workout for your brain, but instead of lifting weights, you're lifting, virtual spiders or whatever it is you're afraid of.
Yeah, you could say that it's really about retraining those neural pathways and those automatic responses that trigger fear and anxiety. And VR provides the perfect platform because it's safe, it's controlled, and it's repeatable.
Wow, that's incredible. It really kind of shows that, VR isn't just a cool gadget. It's really a powerful tool for tapping into the brain's own healing mechanisms. But we're talking a lot about phobias.
Yeah.
What about using VR for something like chronic pain?
Well, that's where it takes a very fascinating turn because instead of directly targeting the pain, it uses things like distraction and relaxation to help manage the pain.
Okay.
So imagine being immersed in a very serene beach
Okay.
while you're dealing with chronic back pain.
I can already feel the stress melting away.
Right.
But how does a virtual beach actually reduce pain?
Okay.
Is it just taking your mind off things?
It's partly distraction, yes, because the immersive nature of VR really captures your attention and pulls you away from the pain, but it also taps into the brain's natural pain modulation system.
Mm.
Pain perception is very complex.
Yeah.
It can be influenced by physical sensations and psychological factors.
So it's not just about the pain signals themselves, but how our brain is interpreting them.
Exactly, and VR can actually influence that interpretation.
Wow.
Creating a very calming and engaging environment can essentially trick the brain into downregulating those pain signals.
Oh, wow.
And there are studies that show really impressive results.
Like what?
One study found that patients using VR therapy reported a 24% reduction in pain intensity compared to those receiving just conventional treatment.
Wow. That's a huge difference.
Yeah.
So instead of reaching for a bottle of painkillers in the future, people might be reaching for their VR headsets.
It's definitely a possibility, and it's particularly promising for those who haven't found relief through traditional methods, or maybe they experience side effects from medication.
That makes sense.
Yeah.
This is all incredibly promising, but, I can't help but wonder, is there a role for companies like 4Geeks in this?
Absolutely.
In this rapidly evolving field of VR therapy?
Absolutely. 4Geeks has such deep expertise in VR technology.
Right.
They're really positioned to be key players in this. They could partner with healthcare providers to develop, tailored VR experiences for different conditions.
That makes a lot of sense. Like they're the bridge between the cutting edge technology and the real world application of this technology, and they can help make it more accessible
Yeah.
and more effective.
Exactly. And they could bring their technical know-how to create user-friendly interfaces, realistic graphics,
Right.
and engaging experiences that truly enhance the therapeutic process.
So it feels like we're on the cusp of a major shift in healthcare, with VR playing a much more prominent role. But before we get too ahead of ourselves,
Yeah. Yeah.
I think we should take a step back and look at how VR therapy actually works on a deeper level,
Okay.
and kind of break down the mechanisms behind it. So,
Sounds good. We've talked about how VR can create these like really realistic simulations for, treating phobias and managing pain.
right.
But it's not just about mimicking reality. It's about using the power of simulation to actually achieve therapeutic outcomes.
So it's not just about creating a pretty virtual world. It's about designing an experience that's really going to trigger specific changes in the brain.
Exactly. Think about it this way. VR allows us to isolate and manipulate, different variables in a way that's just not possible in the real world.
Okay.
So let's say we're working with someone who has a fear of public speaking. We can create a virtual audience in VR and control the size of the crowd,
Oh, wow.
the level of interactivity, and even the facial expressions of the virtual listeners.
So you're essentially fine-tuning the experience to perfectly match whatever that individual's anxieties are.
Precisely. And this level of control allows therapists to create, these gradual exposure scenarios.
Right.
So we can start with a small, non-threatening audience and slowly increase the challenge as the patient gains confidence.
It's almost like a video game for therapy,
Yeah,
but with real psychological principles behind it.
that's a good analogy. And just like in a video game, you have levels and challenges and rewards.
Yeah.
Except in VR therapy, those rewards are things like overcoming fears, reducing pain, and developing coping mechanisms.
It's like gamifying therapy
Yeah.
in a way that's actually evidence-based and therapeutic,
Yeah.
but we've mainly been focused on phobias and pain.
Yeah.
Um, I'm curious about other applications of VR therapy.
Sure.
Like I read something about using it for PTSD.
Oh, yeah. That's a really exciting area of research. VR is showing a lot of promise for helping people, process and work through traumatic experiences.
Okay.
Imagine creating a virtual environment that can safely replicate elements of a trauma,
Mhm.
allowing the patient to confront and manage those difficult memories in a very controlled setting.
That sounds incredibly powerful,
Yeah.
but also very sensitive. How do you make sure that that experience is therapeutic and not re-traumatizing?
Well, it's really crucial to emphasize that this type of therapy is always conducted under the guidance of a trained mental health professional.
Of course.
So they can carefully tailor the VR experience to the individual's needs,
Right.
monitor their responses throughout the process, and ensure their safety and well-being.
So it's not just about, throwing someone into a virtual war zone and hoping for the best.
Right.
There's a lot of thought and care that goes into designing these experiences, and it's always a collaboration between the patient and the therapist.
Absolutely. And the virtual environment itself is never a perfect replica of the trauma. It's more about, creating a symbolic representation,
Okay.
using visual and auditory cues to evoke certain emotions and memories without overwhelming the patient.
So it's like you're using VR to create a safe space
Mm-hmm.
for confronting and processing difficult emotions,
Yeah.
but there's always a safety net there.
Exactly. And it's not just limited to PTSD. VR therapy is being explored for a range of other mental health conditions,
Like,
including things like anxiety disorders, depression, and even autism spectrum disorders.
there's a lot of buzz about VR being used for social anxiety to
Mm.
kind of help people practice social skills or navigate challenging social situations.
Right. For someone with social anxiety, the idea of going to a party or giving a presentation can be terrifying.
Right.
But in VR, they can practice these scenarios repeatedly in a safe, judgment-free environment.
It's like having a virtual rehearsal space about
Exactly.
life challenges.
And the beauty of it is you can control the variables. You can start with a small virtual gathering and gradually increase the number of people, adjust the level of interaction, even change the setting.
So instead of avoiding those situations that trigger your anxiety, you're actively confronting them in VR and building up your confidence and developing those coping mechanisms along the way.
Exactly. It's about empowerment and building resilience.
Yeah.
And VR provides those tools in that platform. And it's not just about mental health.
Yep.
There's growing interest in using VR for physical rehabilitation as well.
Oh, so using it to help people recover from injuries or improve their motor skills.
Precisely, imagine someone who's had a stroke and is struggling with mobility. VR can create these engaging, gamified experiences that motivate them to move their limbs, practice walking, or even engage in virtual sports.
So instead of doing those repetitive exercises in a clinic, they're immersed in this virtual world.
Right.
It's interactive and fun, and they're almost tricked into exercising.
You could say that it's about making therapy engaging and enjoyable, which can lead to better outcomes.
It seems like VR therapy is almost like this Swiss Army knife of healthcare
Yeah.
with applications across a wide range of physical and mental health conditions.
That's a great way to put it. It's such a versatile tool with enormous potential, and the exciting thing is we're just scratching the surface of what's possible.
I know we talked earlier about 4Geeks and their potential role in VR therapy.
Mm-hmm.
It seems like there's a real opportunity for them to be leaders in this space,
Absolutely.
considering their expertise in VR and their passion for innovation.
Absolutely. 4Geeks could be so instrumental in pushing the boundaries of VR therapy, developing cutting-edge solutions that are not only technologically advanced, but also user-friendly and accessible.
Yeah, they could be the ones creating those immersive and engaging virtual worlds that make therapy more effective and enjoyable for everyone.
Exactly. They have the talent, the vision, and the resources to make a real impact in this field.
It's really inspiring to think about how companies like 4Geeks can use their skills to improve people's lives in such a meaningful way. But with all this talk about the potential of VR therapy,
Yeah.
I can't help but wonder, what are the challenges? I mean, it all sounds amazing, but surely there are some hurdles to overcome.
Oh, of course. Well, yeah, I mean, it's easy to get caught up in all the excitement, but it's important to remember that, VR therapy isn't a magical solution.
Right.
There are definitely challenges.
So what are some of those challenges or limitations?
Well, one of the biggest hurdles right now is accessibility. VR equipment can be pretty expensive,
Right.
and not everyone can afford it or has access to the technology or the support they might need to really use it effectively.
Right. Like any new technology, it takes time for it to become more affordable and more widespread.
Yeah.
Are there any other challenges beside a cost?
Well, another big one is standardization.
Okay.
Right now, there's a real lack of consistent protocols and guidelines for VR therapy. So, different therapists might be using different approaches, different software, even different VR headsets.
Oh, wow.
And that makes it really hard to compare, results across studies and to make sure that everyone is getting good quality treatment.
So it's kind of like the Wild West out there right now.
Yeah, in some ways, but that's also part of what makes it so exciting.
Yeah.
It's such a rapidly evolving field,
Right?
and there's just so much room for innovation and new discoveries.
Yeah.
But we definitely need more research, more collaboration, and more standardized approaches to make sure that VR therapy can really reach its full potential.
And speaking of research, are there any concerns about the long-term effects of VR therapy? I mean, it's still a pretty new technology.
Yeah, it's a valid concern.
Yeah.
We have some really promising short-term results.
Right.
But we need more long-term studies to see how those benefits, hold up over time.
Yeah.
Does VR therapy lead to lasting changes in the brain?
Right.
Are there any potential side effects or risks that we need to know about? These are all questions that, future research will need to answer.
So it sounds like there's still a lot we don't know, but the potential benefits are really compelling.
Yeah.
As we start to wrap up this deep dive, I want to kind of bring it back to our listener. Why should someone tuning in today care about VR therapy?
I think the biggest takeaway is that VR therapy represents a fundamental shift in how we think about healthcare. It's not just about treating symptoms. It's about empowering people to, take control of their own healing.
Yeah, like giving people the tools and the agency to shape their own health outcomes.
Exactly. And VR provides this incredibly powerful platform for doing that.
Yeah.
It's so immersive, it's engaging, and it allows us to tap into the brain's own healing mechanisms in a way that you just can't do with traditional therapies.
And it's not about replacing those traditional approaches.
Right.
It's about expanding what we have,
Yeah. Yeah.
finding what works best for each individual.
Exactly. VR therapy is a complement to, the treatments that already exist. It's a new tool to add to our toolkit, a way to really enhance and personalize care.
So it's not VR versus traditional therapy. It's VR and traditional therapy working together.
Exactly. And I think that's what makes this field so exciting.
Yeah.
It's not about replacing human connection or the expertise of, healthcare professionals.
Right.
It's about using technology to empower both patients and practitioners.
I love that. And as we kind of look ahead, it's pretty clear that VR therapy is here to stay. It's going to keep evolving. It's going to become more sophisticated, more accessible, and more integrated into mainstream healthcare.
Yeah, and I'm really confident that companies like 4Geeks will play a vital role in shaping that future, pushing the boundaries of what's possible and making VR therapy a reality for more and more people.
Yeah, it's really exciting to think about the possibilities. So to our listeners out there, we encourage you to stay curious, stay informed, and stay tuned as this field continues to unfold. Who knows what incredible breakthroughs are just around the corner?
Yeah, the future is virtual and it's full of potential.
That's a great note to end on. Thanks for joining us on this deep dive into the world of VR therapy. Until next time, keep exploring.